I'm sorry. I freaked him out a little bit. Ooh.
Woo!
You hear a crack? That's it. So we have Allison here today. Thank you for being here, Allison. And Allison brought her beautiful dog, Beau, in. Beau is 7.5, 8 years old. We don't know exactly the date because he's a rescue. He's kind of a boxer mastiff, right?
Yeah.
Okay. And it's not that I know these things, she told me.
He's had a couple rounds of chiropractic work. When I first got him in 2017, like a couple months after I got him, I noticed that he would wake up from like a night's sleep or from a nap and just kind of limp for like 5-10 minutes on this left shoulder.
Yeah, okay, we're gonna look at that left shoulder too.
And I took him to a chiropractor in LA. I wish I could remember her name, I can't remember.
That's okay.
It's a long time ago. And worked with her for 3-4 sessions, and that completely dissipated.
Okay, good.
So that stopped, and then in like 2022, I think, he had another kind of limping, all of a sudden got up one day and just started limping, and so I did the whole vet thing, and it was still limping like a week later, and I took him to a chiropractor, and that seemed to help.
Okay, different one.
A different chiropractor because we were living in Arizona at that point, because I had switched to a master's
program. No, that's good. That's good that you found someone good.
Yeah, and he was great. And then now we live here.
And
so.
then you did a Google search or something, and it popped up.
Yeah.
Did you see any of the videos that we?
I have actually seen your videos
just to get
of the horses.
Okay, good. So you thought he's a small horse.
Yeah, basically.
Same thing. But you're so cute. Look at you. You're a good boy. Can we work with you today? Is it okay if I give you like a little checkup? Would that be okay? What do you think? All right, think about it. Don't just shout out your answer right away. Think about it. Go ask your mom for a minute. You guys can talk about me behind my back. All right, do you want to do a little work? All right, we've got to work. We want to look at your front left shoulder also. Remember that. I'm going to really check you from head to toe. So let's get started. So let's have him face you. Okay. And maybe not. Come this way. Turn around.
Buddy, come here.
And talk to mom. You want to check me out? Okay. And I want to check his spacing here.
Do you want me to use that sock?
Yeah, the best you could take off. Oh, look like you've done that before. So I'm looking at the spacing of the wings of the atlas between the edge of the atlas transverse processes, or the wings, and the angle of the mandible. So the ramus. So this is the ramus angle of the mandible, and there should be equal spacing. And as I run my fingers down, it feels like there's more space here. Now here, you can reach in and put your finger where my finger is, and that space is between the C1 transverse process and the angle of his jaw. And then check this side out, and it's a little tighter on that side.
Yeah.
Do you see that?
I see what you mean. So
that means that the atlas went superior on the right, more cranially. Yeah. As opposed to caudally is towards the tail, cranial is towards the head.
No, you don't use
and
dorsal.
so I'm going to...
You don't use dorsal?
Well, dorsal would be this
all
way.
The way down.
So dorsal is the back to the front, ventral.
Okay.
But now we're also talking cranial, like superior up.
Right. Okay.
Or longitudinally towards his eyeballs.
Okay.
Or longitudinally towards his tail would be caudally or cranially, dorsally or ventrally.
Okay, cool.
So we're on the same page. All right, can you stop kissing me for a second so I can get something done? So I'm going to push this down if it gives me a chance. Yeah. All right. I'm sorry. I freaked him out a little bit. Ooh. Okay, that's a good shake. But I got it. You're going to see there's going to be more space on that side instantly.
What do you think, bud?
That was a big adjustment. It really made it. Did you hear it crack?
Yeah. What do you think, dude?
So he shook his head right away, which is really good.
Yeah. You feel good? You want some more?
We're done with that spot. All right,
job.
see if you could reach in and feel the difference. There's almost more space on that side now.
Yeah.
Isn't that wild?
That's awesome.
All right, so they have 7 bones on their neck. All mammals have 7 bones except the manatee and the sloth. We differ in our thoracic. So he has 13 pairs of ribs. We have 12 pairs of ribs.
Right.
So we have 13 corresponding vertebrae in our thoracic area, or dorsal, if you want to call it dorsal, in the dorsal area. And cats have 13 also. Horses have 18. Humans have 12. Then we differ in the lumbars. We have 5, they have 7. So cats have 7, horses have 6. Now there's variances, but mostly that's pretty accurate. Okay, so now let's just check range of motion. Bring your head up. A little stiff coming up that direction, so bring your head down. That's good. Bring your head all the way to the left. We should almost get to the shoulder blade on his age. And it gets there, okay. But what I didn't like was the extension was a little rough. So it should come up easier. There we go.
Ooh.
Now watch, it'll, oh, there we go again, we have to react. All
Yeah,
right.
he's gonna say thank you for every time.
It's gonna feel so good. Now you're gonna be able to see the stars.
Now he wants the lower back.
Okay, we'll do the lower back in a second. But let's recheck the range of motion on your extension. Remember, your left lateral flexion was perfect, or near perfect. Your right lateral flexion was near perfect. Your flexion felt good, so I left it alone. Are you paying attention? Because there's a test on Friday, which is tomorrow, so you better cram. There you go, look at that.
Woohoo!
Nice, okay, that's all better now.
Yeah.
Good, so now we're gonna check between your withers, T3 through T8. Bring them around towards you a little bit.
Come on, get up.
And let's bring his butt towards me. There we go. And you control his head for a little bit, okay? So I'm gonna come down this way and check each little vertebra. I'm looking for ones that just don't feel the way the others do. So I'm getting really good joint spring in here, and I'm watching his belly bounce through this, and it's really nice. And as I get to this area, which is the transition area of T13L1, it gets a little locked up here.
Woo!
Okay. That was, did you hear how loud that one was? Okay.
Whoa.
Okay.
You good? I've not seen him react to a chiropractor like this.
Is he scared of me or mad at me? Or
No, I think he's happy with you.
Okay.
I think he's a little shocked. But then immediately coming back to you is like,
Is it a good
yeah,
thing?
that's a very good thing.
Okay. I'm
He's
trying to help. I
yeah.
think he knows deep down I'm
Yeah.
okay. All right, we're almost done. I do want to do your left shoulder, okay?
Shoulder, that's the whole point.
All right. So this I need you to maybe be more active. So you're gonna either kneel and come over here and kind of hold his chest for me, okay?
Okay.
Because I want to get this left foot in the air.
Oh, I know. We gotta do the ouchie spot.
And this is the most important one that we have left.
I know. He's like, I know it's gonna be ouchy, but it's gonna feel better, I promise.
It might not be ouchy, it might be awesome.
Come here, let's see. Come here. I know, I probably should have got some treats.
Oh, we have treats up here. Here you go. You want this one?
Okay.
Okay.
Okay, this is gonna be the big one, but it's gonna be with
So hold on to his collar with one hand, and I'm gonna move his leg up and just kind of get it done, okay? So let me face him. I'm gonna pull this leg in the air.
Oh.
Hear a crack?
Oh!
That's it.
What do
We
you
are done,
think,
people. Did you hear it?
Yeah.
Okay.
Is that what's been bothering you?
Yeah, so his shoulder was out. We call that an anterior humerus, because his humerus came forward. And so I went like this.
For ages.
I do that to horses too.
Are you just a little horse?
He's like a little horse. What do you think of that?
That was great.
So we're done for today.
How do you feel, Ben? Thank you so much.
Woo!
Okay. That was, did you hear how loud that one was? Okay.
Whoa.
Okay.
You good?